Good morning or good afternoon. My name is Ahmet Gurakar. I'm the medical director of liver transplantation at Johns Hopkins School of Medicine. I want to thank my colleagues in Vietnam for inviting me, and especially Dr. Dao asked me to talk about liver transplantation in developing countries in this hepatitis B and hepatitis C focus liver meeting with you today. So I have the opportunity of talking to you and meeting with you for 10 minutes regarding the liver transplantation in developing countries. So I'm not going to go to the details of what are the indications for liver transplantation and how it is done. I think you're mostly familiar with those issues, but I'm just going to talk about how will be the backup system for liver transplant programs in the developing countries. This is the most recent literature coming early this year. In fact, Dr. Rela is a surgeon from India, and he put this expert opinion journal of hepatology saying that the live donor liver transplant programs are the most used or resources at this point in the Asian countries. So as we all know, Dr. Thomas Starzl did the first liver transplant in Colorado in 1963, and it became a routine surgery in the United States starting maybe first part of 1980s. In the Eastern countries, I think it started with Japan, with the first live donor liver transplant being reported using a left lobe graft to a child in 1994. So obviously all the transplantation done in the United States and in Europe by the time were all deceased donation. What are the major indications for liver transplantation in different parts of the world? We know that in Asia, hepatitis C related or hepatitis B related HCC is the most common indication, whereas in Northern America and Europe, maybe alcoholic liver disease and NASH are taking the number one and number two reasons for liver transplantation, whereas in Asia, hepatitis C and B are still the major reason for liver transplantation. Now, what are the challenges for liver transplantation in the developing countries? I think we can mention about support, that support might be coming from the local institutions as well as the governments, legislations that the governments have to put together for successful organ donation. And then obviously, networks for sharing the organs have to be in place before we can start deceased donor or even a live donor transplant program. So this is a necessity that we all have to abide by to have those backup set up. So United States, the overall donation system is managed by UNOS or OPTN in what we call the United Network of Organ Sharing or with sister organizations, Organ Procurement and Transplantation Network. So they oversee the transplantation and donation activities within the United States. It's a very well integrated system. So when we look at the live donor in the United States, it is in the beginning stages. As we see here in recent literature, I looked it up, for hepatitis C only 17% of the live recipients received live donation versus 32% of the HCC cases received deceased donor transplantation, which is obviously deceased donor is more commonly used in the United States. This diagram shows the increase of the live donation cases in the United States. As you see, it started going up in the early 2000s, but there's an unfortunate case of a live donor death in 2001. After that, the donation decreased. It decreased as low as 200 a year, but nowadays is approaching 500 and above again. So if we look at the Vietnam, I looked at the recent literature that came out in July 2018. I could find out there's almost like 2,300 living donor organ transplantation in Vietnam reported, and only 174 donation after brain death, basically deceased donor organ transplantation has been reported. That contains all the liver and kidney transplantation together. And there are no pediatric transplantation reported. And there's also 3 donation after cardiac death has been reported. This is a new donation technique, so it's doable in Vietnam as well. So how about the other countries in Asia? We know that in Iran and South Korea, the donation rates are the highest in the whole continent. Is as high as 9.5 in Iran and 8.6 in South Korea in million population. So the governments have done a lot of incentives for the people to be encouraged in donating after death, so to speak. In India, I think the system still depends mostly on live donor liver transplantation. This recent literature, even with the acute liver failure, they use live donation, and they still they report good outcomes, good survival outcomes. How about Pakistan? I think they also depend on live donation. I think they mostly use for the indication of HCC, and they also report good and then comparable outcomes and results. How about China? Obviously, they were depending on the deceased donors, and lately live donors have also become a source. And their literature also talks about like good outcomes with both in the cadaveric and live donor outcomes. Now, in Arab countries, I think in the recent years, there have been an increase in the live donor activities. They talk about that live donor represents 80% of their transplant activities, and only 20% of their transplant activities are due to deceased donation. And 56% of the reported cases of transplants are from Egypt. So Egypt, due to the hepatitis C load, I think they're becoming the major transplant country in the Middle East. And also Turkey, starting from the early 2000s, they made a big improvement in their system, and the live donation as well as the deceased donation. Their deceased donor transplants are 34%, roughly 34%, whereas their living donor transplants are 66%. I think in a 10-year period, they're talking about 4,000 living donors and then 2,000 deceased donor transplantation. In conclusion, shortage of trained personnel, availabilities of supporting resources, ethical issues, and shortage of donor organs and education might be the limiting factors in organ donation in Asia. And obviously, we are here to discuss with you how we can give you the and how we can train the personnel for the liver transplantation in your country as well. And with all those things, I think we are seeing encouraging outcomes from the Asian countries. And then I want to talk to you about International Liver Transplant Society, which I'm a member, also committee member of the membership committee president for this year. And I would invite the interested surgeons or hepatologists or anesthesiologists to join the ILTS also, and would hopefully will be coming back to your country to give you more conferences in person, and to continue with the training of the people who are involved with liver transplantation. With that, I will be ending my slides, and I'll be more than happy to take the questions if there are any questions. Thank you very much for your attention. Thank you.